It's Dr. Ahmed here again. I'll be talking to us today about liver cancer. Liver is the largest internal organ in the body and it helps us to break down harmful substances. What is liver cancer? It is when the liver cells grow out of control. Liver cancer is the third most common cause of cancer-related deaths globally, and it is more common in men than women. It is highly prevalent in Africa and Asia due to the prevalence of hepatitis infection. Follow me as I talk about the symptoms of liver cancer, the risk factors, and how to prevent it. What are the symptoms of liver cancer? People with liver cancer can present with abdominal pain, which is usually common in the right upper quadrant when you divide the abdomen into four. Also, they can also present with abdominal distension or swelling. They can also have yellowness of the eyes, generalized body weakness, loss of appetite. Sometimes they feel like vomiting or they vomit. And lastly is unexplained weight loss. What are the things that put people at risk of developing liver cancer? There are factors that can be modified. That means that we can control. And there are factors that cannot be modified. That means they are beyond our control. Modifiable risk factors include chronic hepatitis infection. That means a long-standing hepatitis, they tend to develop liver cancer. And also chronic use of alcohol, then smoking, obesity, and consumption of moldy food. Some food grains have been shown to contain a substance we call aflatoxin. This aflatoxin is caused by fungus infection. When it is consumed, people tend to develop liver cancer. What are the factors that cannot be modified in liver cancer? First is age. People above the age of 50 years have been shown to have increased risk of having liver cancer. And also gender. It is quite common in men than women. And lastly is family history. People that have siblings, father or mother with liver cancer also tend to be at increased risk. How do we prevent liver cancer? The first and foremost is to get vaccinated against hepatitis B infection. Hepatitis B infection is quite common, especially in this part of the world. So getting vaccinated is highly recommended, and this can be done in various hospitals. So I advise that you visit them. Another way to prevent liver cancer is to ensure that you are treated as soon as possible if you are diagnosed with hepatitis infection by a qualified medical doctor. Second is to avoid heavy alcohol intake, as alcohol intake has been shown to increase the risk of liver diseases, which also include liver cancer. Also, avoid unprotected sexual intercourse. Try as much as possible to use condom to prevent sexually transmitted infections such as hepatitis B infection. And also, to avoid sharing of sharp objects. Those of you that go to barbing salon without your clipper, I pity you. It's quite encouraged that you get your own personal clipper so as to prevent you from getting this hepatitis B infection, and also to reduce your weight by regular physical exercise. Thank you for listening to me. Kindly like, share, and also follow my social media accounts.